Hi, my name is Tanya, and this presentation is for my BCIT class, the Breastfeeding Experience number 7155. In this presentation, we will be talking about breast engorgement with twins. We will be using the clinical decision-making process throughout this presentation. This involves 5 categories, which we'll be looking at into more detail. Just a quick outline. In the knowledge section, we will be looking at the definition, the pathophysiology, and some causes and risk factors. In the cues component, we will be seeing signs and symptoms of engorgement. In judgment, we will be looking at what could be happening in relation to the mother and baby, along with 3 priorities of this problem. In decisions, we will be seeing preventions and treatments along with nursing interventions. And finally, we will be looking at the evaluation of the outcome. So is the mother able to evaluate the effectiveness of the situation? Definition. Breast engorgement is the painful overfilling of the breast with milk. This is usually caused by an imbalance between milk supply and infant demand. Therefore, the milk supply is more than the infant demand. Usually it occurs between 3 to 5 days after delivery of the placenta. However, it can also happen at any time during the breastfeeding experience. Pathophysiology. At delivery of the placenta, hormones change in the mother's body. There will be increased prolactin, decreased progesterone, and decreased estrogen. Prolactin is released from the interior pituitary gland, which is responsible for milk synthesis. Therefore, it increases milk production. Overdistension of the breast occurs due to increased supply of milk and decreased surface area capacity. When the increased production occurs without emptying of the breast, the capillaries and ducts become obstructed. This can also be very painful for the mother. Engorgement can vary from mild, moderate, or severe. It is important to understand the concept of supply and demand. Twins will need more milk supply in order to attain a proper nutritional value. Milk synthesis is controlled at the breast, therefore, the more milk is removed, the more is produced. The more the baby feeds, the more production will occur in the breast. Twins produce more stimulation at the breast, resulting in an increased milk supply. Some causes and risk factors. Twins are at an increased risk for premature labor. Premature babies have a more difficult time achieving a proper latch. This leads to ineffective feedings. An inadequate letdown, impeded milk flow, which can be caused by breast surgery or a blocked duct, having small breasts, having twins. Twins will need an increased supply of milk. Therefore, with small breasts, the mother will have to feed or pump more often in order to prevent the breasts from becoming overfilled and causing engorgement. Being away from the baby is also a risk factor. The mother is not able to observe her hunger cues and feed her baby as she would like to. Therefore, it is important to manually express milk, which we'll be looking at further on in this presentation. Cues. Some signs and symptoms of breast engorgement. The breast will feel full, usually both sides. There will be shiny and half-taut skin. There will be reduced nipple protractility. Blood vessels will appear. Possible trauma to the nipple. The areolas might be puffy. There will be edema. Breasts feel heavy and painful. The nipples are very sensitive to touch. And there will be an inhibited letdown reflex. Breast engorgement is diagnosed solely on these above signs and symptoms. Judgment. What could be happening to the mother and baby? The mother will be feeling lots of pain in her breast, will be in discomfort, and will have sore and cracked nipples. The baby, therefore, will have a poor latch and will have inadequate nutritional intake. This may impede the mother-baby relationship because of the difficulty in the breastfeeding experience. Three priorities to look at when dealing with engorgement in twins is feeding the infant, moving the milk, and helping the dyad. Priority number 1 is feeding the infant. The mother needs to ensure that the baby will have a proper latch, and using different positions with twins is helpful in pulling milk from different parts of the breast. Moving the milk. Manual expression of milk is important also to prevent stasis and promote milk supply and demand. This is also important if the mother is away from her baby, therefore manual expression comes into place. Again, having different feeding positions with twins is also important in moving the milk from different parts of the breast. Number 3, help the dyad. 3 important rules to remember in order to prevent engorgement will be early and often, effective feedings, and exclusive feedings. In other words, feeding the baby early after delivery is important. This will also promote the mother-baby relationship. Effective feedings comes into place also when looking at having an effective latch. Exclusively feeding is important with not having any pacifiers or bottle feedings. Judgment. Consultations. When there is a problem with engorgement or mothers feel left alone, there are other places that can be contacted in order to help in this process. There is a lactation consultant. In most hospitals, especially on the postpartum unit, there's a lactation consultant available to help all breastfeeding mothers. Once the mother is home, there are breastfeeding clinics, which will always have the door open for mothers to go into. There's a public health nurse, there's the postpartum doula, and there are also social media groups nowadays where mothers will chat and have similar problems and will help each other. Preventions. The labor and delivery team should assist with the first breastfeeding experience in order to prevent the mother from feeling overwhelmed and achieving a proper latch. This should be done within the first 2 hours after delivery. Nursing frequently. This is done 8 to 12 times per day in the first 24-hour period. The baby may not nurse 8 times during the first 24 hours. However, the breast should still be offered to the baby. Looking for and recognizing the baby's hunger cues will also help in breastfeeding. With twins, the mother can breastfeed both breasts at the same time. Twins are at an increased risk for premature delivery, already making the suck and swallow reflex slightly more difficult. The muscles used to suck on a bottle or pacifier are slightly different than those used to breastfeed. The infant may have a harder time breastfeeding and learning to feed from a bottle. Ensuring a proper latch will ensure the infant is feeding well. When a proper latch is achieved, there are various feeding positions. In this slide, you see different positions of mothers feeding twins. There is nursing twins lying down, so you see the mother lying down and both babies are feeding at the same time at different breasts. The football hold. In the middle, we see the cradle hold, which the mother is feeding one baby at a time. And then there is the laid back nursing. Treatments. Analgesics, such as ibuprofen, can help reduce pain and swelling in the mother. Eliciting a letdown. This will allow the milk to leak out also and slightly soften the nipple and areola. This can be done by providing skin to skin, which is known as kangaroo care, applying warmth, having a gentle massage, or applying warm showers to allow the warm water to flow over the breast. Emptying the breast. This can be done with a breast pump, manual expression, or feeding the infant. Applying a cold compress. Applying a cold compress may help reduce the edema. Some women like to apply cooled cabbage leaves. However, it is important not to apply them for more than 20 minutes at a time. Providing a gentle massage. Softening the breast with hand expression will allow the breast to become a little softer. The infant will then be able to latch properly, or a breast pump will also work. Once softened, frequent effective feedings are essential in order to prevent reoccurrence. Nursing interventions. What can we, as nurses, help the mother feed the infant? We can wait and watch, observing the mother and baby during the breastfeeding in order to determine if a good latch is achieved. Should we try something? Trying different feeding positions, especially with twins, may be helpful for the mother. Some mothers prefer one feeding position over another. Ensuring the mother is understanding. It is essential to provide proper teaching to the mother in order for her to understand what breast engorgement is, along with the signs and symptoms and how to prevent it. Evaluation of the outcome. How to know if the right decision was made. There are questions to ask in order to answer this. Did the decisions achieve what I wanted to happen? Should I make another decision? Or should more information be collected? Is the mother still experiencing breast engorgement? If so, we should try different options. Is she moving the milk, and is the baby having an effective latch? Having an effective latch will help in moving the milk. The baby will feed effectively and move the milk out of the breast and prevent overfilling. To finalize, in this presentation we looked at engorgement with twins. Engorgement is the overfilling of the breast with milk, which can cause pain and discomfort in the mother. It can also cause an ineffective latch in the infant, causing ineffective feedings. It is important as the breastfeeding mother, as well as nursing professionals, to know these signs and symptoms, therefore in order to understand when to seek further medical attention. If these symptoms are not recognized and treatments and preventions are not done, engorgement can further cause mastitis. If the breastfeeding mother is aware of preventative measures, she is able to prevent engorgement from happening. However, if engorgement does happen, there are treatments that we can use. If the mother would like to consult someone else, there are people that can be consulted in order to help with breastfeeding and breastfeeding problems. The most often one is the lactation consultant. Mothers also like to talk to each other with personal stories that helped each other. This was my presentation on engorgement with twins. I hope you liked it. Thank you.